Hello friends, my name is Ankit. I make educational videos on US healthcare. I'm back with another video on patient cost transparency. If you are new to my channel, welcome. If you continuously watch my videos, I want to thank you for your support. Please like and subscribe to my channel so that you are automatically notified for any future updates. Now let's talk about today's topic. What exactly is patient cost transparency? A lot of us may have run into this scenario that we are suffering from a chronic disease and our doctor or provider suggests us to go through some procedure. At times, we are unaware of the costs associated with these procedures and we go ahead with the procedure, and then later on, depending on the complexity of the procedure, sometimes we are submitted a bill which could run from thousands of dollars to hundreds of thousands of dollars. Lots of Americans, they run into medical bankruptcy due to these scenarios. So this is one of the initiatives that is trying to increase transparency in the healthcare processes and ensure that the patients are shared the good faith estimate and advance explanation of benefits in advance so that they can make an informed decision whether to go for that particular procedure or look for a alternative. So this particular IG, it provides detailed guidance to support providers and payer exchanging financial information for specific services and items using FHIR-based standard. This exchange involves a provider submitting a good faith estimate, also known as GFE, to a payer, and the payer generating a advance explanation of benefit, also known as AEOB, for a patient, which may optionally be returned to the submitting provider. This information about the cost of healthcare item or services may enable better decision making by the patient in consultation with the provider. There is no requirement or HIPAA mandate to use administration or patient transmission standard. However, HL7 and X12 work collaboratively to support implementers to align requirements with claim submission standards to ease the burden of implementation wherever possible. This IG is informed by the No Surprises Act, which was enacted as part of the Consolidated Appropriation Act 2021. The No Surprises Act specifically requires that a provider share good faith estimate with a payer, and the payer returns a advance explanation of benefit available to a patient in advance of the service. Let's talk about the interaction between various actors. So we have patient, we have submitting provider or facility, and we have the payer as the actors in this particular workflow. The patient probably visits the payer or the provider or the facility, and they request a cost estimate. That triggers a advance EOB creation request. The provider facility composes the good faith estimate. The good faith estimate is submitted using post request via FHIR to the payer. The payer also receives the AEOB GET request in the FHIR format from the member. The payer returns the AEOB response in the FHIR format to the patient, but also optionally it can return the response to the submitting provider or facility as well, depending on how the workflow is designed. In this particular slide, we have just additional details about the workflow. So we'll skip this one and move on to the next slide. The next slide talks about the good faith estimate response workflow. So in this particular workflow, the good faith estimate request is submitted. The system verifies whether it is received or not. If it is received successfully, then the system next verifies that if it is FHIR conformist. If yes, then it moves ahead in the workflow. If no, then it returns the 412 error to the submitter. Now, after receiving the good faith estimate bundle, then it verifies whether that's sufficient information. If yes, then it processes the good faith estimate bundle and also sends an acknowledgement to the submitter saying that everything looks good. After validating that it is sufficient information, it moves on to the next step and produces the advanced explanation of benefit. If there is no sufficient information, then it notifies the patient as well as it returns the information back to the submitter that they need to submit the response again with additional information. Now, once the advanced explanation of benefit is generated, it can be accessed by the member using the third-party app after successful authentication and authorization, and the member receives the advanced explanation of benefit information using the third-party app. So in this particular workflow, the member is using the patient access API workflow where the member can access their medical or clinical information using a third-party app which is connected to a FHIR compliant platform. So similar to their Carin BB claims or US core information, the member can also access their advanced explanation of benefit using the third-party apps which are connected to a FHIR compliant platform. The next part, a couple of workflows, they are just talking about the provider and the patient perspective, but we already touched base on it. Now we'll talk about certain examples. So the first example here is a MRI scenario. There are certain assumptions that we'll go through. The patient has single commercial insurance coverage and plans to use it. This is clinically appropriate. Clinical decision support CDS score. Service location is known, for example, address. All providers in the network, PCP, imaging facility, and reading radiologist. While medical management techniques such as prior authorization will be included as a disclaimer when applicable in the advanced EOB returned to the member, the actual process of meeting medical management requirement is separate from the process of creation of EOB. For details, we can view the patient cost transparency implementation guides. Now, the scenario is that Eve better half sees Dr. Patricia Primary, a PCP at ABC Medical Group on Monday with a prolonged migraine headache lasting over a 4-month period. Dr. Primary recommends a brain MRI with a CPT code of 70551. She walks to the PCP front desk. They enter the order in the EMR system and direct the patient to ABC's radiology department. Radiology reviews the order for completeness and accuracy and confirms all needed information is present. The next day, Eve calls the radiology center, ABC Radiology, with a particular NPI number to schedule her brain MRI and provide her coverage information which she plans to use. The MRI is scheduled for 9 days from today. This triggers the creation process for an advanced explanation of benefit. Optionally, Eve can also log into the radiology site to download the information about her expected services, should she want to request an estimate separately. The ABC Radiology's office administrator enters the service and coverage information, initiates the process with other potential providers to generate the GFE for the expected charges with the expected billing and diagnostic code. Now, this is an interesting scenario. So the good faith estimate request can be submitted by multiple providers who may be treating a particular episode for a patient. So that's why in this scenario, ABC Radiology can connect with other providers, collect their information, and submit a consolidated good faith estimate request to the payer. The information is sent to the payer. The payer receives the GFE. Within 1 business day, the payer adjudicates it and sends the GFEs of cost sharing, and progress towards meeting deductibles and out-of-pocket maximum, as well as whether a service is subject to medical management and relevant disclaimers of estimates as an AUOB securely to Eve. Optionally, the payer also sends a response to ABC Radiology Office Administrator with the same cost estimate information. Eve receives the AEOB from the payer based on the information provided by ABC Radiology. Optionally, Eve or an authorized user could use their third-party app to query the advanced EOB via API if supported by their payer. So in this scenario, Eve will get to know about that procedure cost in advance. She can make an informed decision whether to go ahead with that service, and in certain scenarios probably she can directly negotiate with the radiology service for a better rate if they are willing to provide better rates than what she would have got through her insurance. So it increases the transparency in the system, encourages the providers and payers to be more transparent, display the rate tag associated with every service, and gives a power to the member to make an informed decision about their procedure or treatment. Now, before we close this particular video, let's talk about how the patient cost transparency implementation FHIR guide it connects with other IGs. So if you look at it, there are 2 main components to it. One is the good faith estimate and one is the advanced explanation of benefit. The good faith estimate, there are different resources from which it is collecting information. For example, PCT organization, PCT coverage, HREX organization, PCT practitioner. So in a nutshell, it is connected to the US core practitioner resources, HREX practitioner resources, and the US core patient resources. Similarly, advanced COB is also connected to the US core practitioner, US core organization, and HREX coverage resources. For additional details, please refer to the HL7 FHIR Patient Cost Transparency Implementation Guides. If you have any specific questions, feel free to comment. Look forward to hearing your feedback. Until next time, I'll see you in the next video. You all have a good day.